I just want to run through a few slides here, and then we can have a little bit of a discussion. I apologize if some of this is not is old hat. So, the thing about all this stuff is it's changing daily, hourly. So please be aware. The current situation is changing very rapidly. What I tell you today is probably going to be different tomorrow. So that's the kind of world we're living in right now. I put together some resources that I think will help. I want to talk a little bit about the sort of the numbers. What are we dealing with? This is the current state of play, which I took from the Hopkins site just a couple of hours ago, and I suspect since then this has probably changed again. So massive scale of incidents and death. Unfortunately, the US is top of the league right now. Worldwide, 576,859 cases with over 26,000 deaths. In the US, we're now rapidly approaching 100,000 with probably now close to 1,500 deaths. So this is basically what the medical community has been told to discuss as regards who to screen, who to test. There are specific recommendations obviously for hospitalized patients and healthcare workers with symptoms, which come to the top of the list. No surprise there. Certainly, older folks, 65 and older with symptoms, long-term care folks with symptoms, and first responders. And then down at the bottom, critical workers with symptoms, healthcare workers, and people with mild symptoms in communities with lots of COVID hospitalizations or contacts. So, there are pros and cons of testing. There's a big discussion right now. Should we be expanding testing? Should we be just testing people who have symptoms? As I say, it's changing on a daily basis. But right now, these are the recommendations that physicians are being told to follow. The feeling right now is that, if you have symptoms and you don't have any severe respiratory or chest symptoms like wheezing, shortness of breath, pains in the chest, then it's perfectly acceptable to stay at home and to self-quarantine at home. What does self-quarantine mean? Well, it means basically having your own room, hopefully your own bathroom. Do not share utensils or any other things like towels and knife, fork, spoon, plates, things like that. Try and isolate as much as you can. If you have a designated room in the home, please, plan on using that. The chances of, at least one or two people on this call becoming positive in the next couple of weeks is extremely high. So please think about home quarantine, how you might do that. There's a document that we sent out earlier which details should you become positive or should you be quarantined. There are some instructions there on how to actually, carry that through, how to wash certain surfaces, stay away from pets, and obviously hand hygiene has been drilled home. You guys are probably sick of hearing hand washing and social distancing, but that's really what it's all about. So if you are quarantined, when can you stop being quarantined? Well, the CDC recommends 7 days since the onset of symptoms and 72 hours since recovery, with improving of any respiratory symptoms that you may have, and no fever. No fever means particularly off things like Tylenol and ibuprofen. Healthcare workers are basically following the facility policies that are in place. And obviously, some of these policies are going to vary across the country. But that's the current CDC recommendations. Go to the CDC website. There's a whole bunch of stuff on what to do if you think you may be positive, what to do if you're absolutely positive from a test, and how to actually implement home quarantine measures. So a little bit about the science that's been thrown around right now. This SARS-CoV-2 virus can live on certain surfaces for varying amount of times, aerosolized in the atmosphere. It can actually survive for up to 3 hours. Plastic, particularly polypropylene, and any plastic covering on goods that you might receive, via Amazon or whatever, 72 hours. That's kind of a lengthy time period for plastic covering. Stainless steel, about 48 hours. Cardboard's important because of, things like Amazon packages and things coming to your door, 24 hours, okay? There is a lot of discussion in the medical community about transmission from both aerosol and fomite transmission, things like door handles, gas pumps, anything that you touch, essentially. It's that easy to contract from these surfaces that we need to start paying, I think, more attention to this. And as a consequence, what do we do with that Amazon delivery? Well, the current sort of medical community got together and decided that this was kind of the best approach. You don't need to leave that box on your porch for 24 hours like some people are doing. Obviously, it can be stolen is another downside. Open the box on the doorstep, okay? Take out the contents and dump the contents into the house. Keep the cardboard box outside and recycle it. And then obviously clean your hands. If you want to use gloves, that's fine. It's not necessary, but some people feel more comfortable wearing plastic gloves if you have them, but make sure you wash your hands thoroughly after any cardboard deliveries. A little bit about treatment. Despite what our president said, there are no FDA-approved therapies for treatment or prophylaxis of COVID-19, okay? This includes all the repurposed drugs, off-label prescribing, etc. There are a whole bunch of clinical trials underway looking at treatment and prophylaxis in various different categories. There's some interesting work about what we call convalescent serum, where you take the serum from people who actually have had COVID, and they obviously have antibodies, and you basically extract those antibodies and you can actually inject them into people as a stimulus to stimulate their immune system to then become immune. It's being looked at. It's probably going to be more successful than the hunt for a vaccine. The hunt for a vaccine is probably going to take at least 18 months to make a safe vaccine. The problem with vaccines is you don't want to do it too quickly, because sometimes vaccines can cause more problems than they're worth, and it can actually, stimulate the disease process. So lots of trials underway. People are looking at some antiretroviral drugs, antiviral drugs. Remdesivir is one. Lots of trials ongoing. Chloroquine, people have been speaking about a lot. Chloroquine and hydroxychloroquine. It seems to have a little bit of antiviral and anti-inflammatory activity. It's been used in the past against viruses and has had sort of mixed effects. It's not great, but it may have a small effect. There are some reports that it will clear the virus a little bit more rapidly than your body's own immune system. It's pretty cheap, but there is some limited supply. There is limited supply rather. So again, lots of trials underway. There is a little bit of a discussion amongst the medical community about certain physicians stockpiling chloroquine and azithromycin. I know for a fact that's happening in Marin. I do know of one provider in Marin that is writing prescriptions for family members. We have to discourage that. We have problems with antibiotic resistance right now with azithromycin. And if we need to start using azithromycin for secondary pneumonias, we're going to need that to be on hand. So I'm trying to sort of spread the word to stop this ridiculous notion of stockpiling, which has to stop. But that's a separate discussion, just so you guys know what's out there. Hydroxychloroquine, again, lots of trials underway. It's probably from initial studies or initial reports rather, it may be a little bit more effective than chloroquine alone. It's also better tolerated and you can use higher doses, and there are fewer drug-to-drug interactions. So again, nothing concrete right now, tons of trials underway, so watch this space. Other antiretrovirals, combinations are being studied right now, different antiviral medications that we use for other conditions like HIV, hepatitis B, etc., are also under investigation. Lots of talk about whether you should use ibuprofen. You may have heard this in the news, ibuprofen in COVID-19. Some people take what are called ARB drugs or ACE drugs, which are for blood pressure. There is some indication that you might be protected, and there's some indication that it might make the condition worse. We don't really know. As regards ARB and ACE drugs, the important thing is not to take people off these drugs, to keep them on them. And then the other big issue is ibuprofen and Tylenol. It seems like if you do have a fever, Tylenol is probably safer. There's no real data to suggest that ibuprofen is bad, but it seems common sense to advise if you have a fever to use Tylenol first. It seems better tolerated. The French are advising against the use of ibuprofen, but there isn't really any data to substantiate that. In the US, it's Tylenol first, and then ibuprofen as a second line medication. I want to talk briefly about behavioral health. Not a lot of people are talking about this, and we need to start raising the awareness of this. This is something that is going to be a huge factor in the coming days and weeks. Once you isolate people, you will see increasing, obviously fear and anxiety is out there already. People are extremely stressed out about this in various degrees, and people handle this in different ways. Depression will increase. Major depression cases will start to rise significantly. And unfortunately, I think we're going to see, increased suicide rates. We're going to see domestic abuse, increased alcohol consumption, drug consumption, etc. So this is going to be a huge issue. I cannot stress this enough, and we need to start preparing for this right now. There are some initiatives underway, but this is something that we as not, everybody as non-medical people can actually do something about this. It's important that you support yourself and your family here. And your neighbors. I'm taking care of a 92-year-old guy across my street right now who needs, constant sort of supervision and reinforcement and encouragement. Just basically talking about this is one thing you can do with anybody. If you're worried about anybody, talk to them and make sure they get help. Take breaks, from all the stuff that's out there. All the social media stuff and TV, etc. It can sometimes be a bit too much for people. Do try and take care of yourself as regards exercise. If you can, exercise indoors if you can. Exercising outdoors is probably okay with social distancing, etc. Eat well. Obviously the odd drink now and again is not going to kill you, but just be careful alcohol wise and drug wise, and get plenty of sleep. Connect with people. Okay, it's the most important thing on this slide is to connect with other people, talk with people, family members. I've actually made a point of calling people on Facebook across, in the UK, across the US that I haven't spoken to in a long time. Just click on that Facebook video button, have a quick chat with them. I spoke to a buddy of mine who I went to medical school with years ago. And so, reach out to people, talk to people, be open, ask if people need help. And obviously, if it becomes a real problem, if the stress levels go up, call your primary care doctor and get help. Lots of different advice lines out there for behavioral health problems, some substance abuse helpline, interesting text, text talk with us to 66746 is obviously with the younger population who seem to spend all day texting, that's obviously, a big plus. I think domestic violence is going to be a problem as well. I hate to be, doom and gloom here. I'm just trying to, raise awareness here about what could happen and what we possibly can do about it. The other thing that I've been thinking a lot about recently is, living wills and advance directive. And I know that we probably have other folks on the call who want to take this on, after I'm done. But this is really important, okay? If you do not have a living will or advance directive, please, please, please think about, exploring this. It's extremely important that now more than ever that we have this in front of our providers to direct providers what to do, okay? Advanced directives will guide the choices for doctors and caregivers if you're terminally ill, injured or in a coma or whatever, for lots of different reasons, but now more than ever. So if you've not addressed this, please, please think about addressing it. It's extremely important. Talk to your doctor, talk to your primary care doctor. All these issues can be placed in a living will. What do you want to do as regards CPR? Do you want to donate organs? Do you want to, do you want end-of-life pain medicines? Do you want to be fed by a tube? All this sort of stuff is very important to delineate in your living will. It's difficult to talk about. I agree. It's difficult to bring this up, and not many people really, obviously nobody enjoys talking about this, but I think in this day and age, this is essential. Just a word about telemedicine. You guys have probably been, or you may have heard me banging on about this for quite some time. I'm a big sort of telemedicine advocate. I've been doing a lot of telemedicine consults for Teladoc primarily, and with the current sort of outbreak, this is actually a screenshot of my waiting list. I'm licensed in about 6 states, I think. So currently, when I turn on my my Teladoc platform, there are over 200 people waiting for a phone call and over 200 people waiting for a video consult. So this is kind of, telemedicine is here. This is the birth of telemedicine, if you like, here to stay. Lots of different telemedicine providers out there. Teladoc, MD Live, Amwell, Doctor on Demand, PlushCare, etc. For both general medical issues and behavioral health issues. Primary care docs are setting up systems as we speak. Kaiser have been doing this for a long time and are really the experts at this. They provide a really good suite of electronic tools to connect with your doc and other providers. Brown & Tolan have just rolled out a complimentary VC platform to all their 1,500 docs. A little bit of a plug for my company that I'm working with right now, Upswing Health. We're actually doing free consults for anything in the musculoskeletal space, which we hope will reduce the burden on emergency rooms. So people get injured or have anything musculoskeletal related, they don't need to go to an urgent care or an ER. They can come to Upswing and get a consult. If you want to learn more about telemedicine, I just wrote an article, actually a lengthy article on LinkedIn. If anyone's interested, I can send you the link. So good sources of information, a lot of stuff out there. These are the sort of things that I've been following. ProMed Mail is actually International Society of Infectious Diseases. A lot of detail there, mainly sort of physician bias, but if you want to take a look, there's a lot of stuff there. The John Hopkins tracker I look at regularly. CDC has some great articles on corona, how to self-quarantine, what do you do if you're positive, how you take care of family members, etc. Very, very helpful. And then a whole bunch of sites, Washington, UCSF, NYU, OHSU, and Intermountain Healthcare. There are a bunch of local and state Department of Health phone numbers available if anybody needs to contact anybody in that area, please let me know, and I'll forward those numbers on to you. From a physician perspective, everyone looks at New England Journal of Medicine and JAMA have a lot of coronavirus updates right now. New York Times, Washington Post have some excellent authors, reporters in this space that are producing some very informative information. And then Worldometers is actually similar to the Hopkins site. So with that, that was a lot to throw at you in a few minutes, and I apologize if you've heard a lot of this before. But please share this with other folks who may not understand the concept of social distancing or home quarantine measures. We're going to get through this, guys. So hang in there. I know you're all doing some wonderful things. I really impressed with the whole community out there that's getting together and providing masks, and people are doing all sorts of wonderful things. Developing ventilators. The Dyson guy just constructed a ventilator like within 10 days and has produced about 15, or is producing about 15,000 of them. So some amazing initiatives out there, which is very heartwarming and really good to see. So
Adrian, maybe a couple quick questions before we shift gears. So there was one from Lenny and one from Jeff that were kind of related. Jeff's was given the restrictions on testing, does the reporting number even matter? And Lenny's was related, which is, do we have a sense of where we are on the curve in the US and California?
Yeah, exactly. Good question. So undoubtedly, these numbers the numbers I showed earlier are false. Okay, there are tons of people out there who have COVID and have mild symptoms, and it's really impossible to test those people. It will be silly to test those people because the risk of them leaving their home and going to a testing center or a doctor's office or whatever is far greater than if they stay at home. So yes, there's going to be a large number of people who are undiagnosed, who have mild symptoms. I think we have to put up with that. There's not much we can do about that. However, if someone is at home and does have any respiratory symptoms at all, worsening cough, worsening wheeze, shortness of breath, pains in the chest, whatever it is, they should contact their local either primary care doc, Department of Health, emergency room, and they will triage you on the phone. If they think this is significant, they will get you in for testing, and then you'll have to go through the procedure for testing. They'll give you a mask and all the rest of it. So the curves, I think, are in some areas, from what I can gather, are encouraging. If you look at Marin, for instance, I think we seem to be doing a good job. There are not that many cases. Obviously, that's going to change day to day, and you can see in certain areas where the social distancing has been promoted so highly, it does actually make a difference, and that's really encouraging. So there are a few local curves that I've seen that are starting to sort of slow, not come down, but the rate of increase is certainly less. And I'm absolutely certain that's because of local policy around social distancing and enforcement. My view is that if we adopt a nationwide complete lockdown, if we could, we would get rid of this thing in about 4 weeks. That would be my guess. There are still folks out there not paying attention and not and doing stuff that is pretty crazy. I went to walked from my local park a few days ago, and there was people playing pickup basketball. Well, that's just crazy, right? If you see that, please, post it on Nextdoor, whatever you need to do to raise awareness, because, there are a lot of people, pretty young people, are still in denial over this. So yeah, get the word out.
I know there's lots of questions here, guys, and I don't want to miss them. So we will repost the question line into the Slack channel and get the Slack back out to you. And I know Adrian, myself, and others will be happy to answer some of these other questions, but I did want to shift gears unless there was something urgent. I'm looking at the questions. I think, John, I think your mortality rate one was partially answered, but it looks like 1% if there's good,
Right.
efforts to mitigate,
Right.
but 4% if there isn't mitigation, which is
Exactly,
sadly
yeah.
what Italy's
Yeah.
going through.
Yeah, I should have highlighted that. Thanks. Yeah.
Yeah. No
When
worries.
do you, one last question, Chris, might just be helpful,
Sure.
is in terms of for what you're seeing now in terms of the timeline when things, begin, what does the return to normalcy start to look like from your perspective? And how long are you personally thinking that, these types of things are going to go on for?
I think it's a good question, and it's impossible to give you a concrete answer. I can give you my gut feeling. I think we're about 10% in, 10 to 15% into this right now, and I think we're going to have to lock down. More states are going to need to have more aggressive procedures as regards shelter in place. If we do that, we could probably, like I say, we could get rid of this in 4 or 5 weeks. I'm not sure that's going to happen. If it doesn't happen, if we continue with the same policies, I think we're looking, I would say 12 weeks at least before we can start seriously thinking about, reversing some of the policies. That would be my guess. I think it might even be longer. Could be 16 weeks.
I have a question. Can I ask?
Yep.
So China closed the whole district and people couldn't travel there and back. European Union countries closed the borders, so people can't move within countries. United States hasn't put this in place yet. Do you think that this will happen, or why is United States not doing something that elsewhere proved to be effective?
That's probably a question for our president, but yeah, I agree. I mean, I think the more we can do to lock down as much as possible, it's painful, right? It's you have to go through painful measures to get on top of this. The more lockdown we do, the more we restrict travel, the more we restrict movement, the quicker this is going to flatten the curve, and we're going to get over it. There are far too many states with too lax regulations right now. We have to tighten things up. There's no choice. I don't think. But that's a question for the higher ups and the government. And I agree with you. It should be tighter.
But sorry, I'm not American. So do you think that we as businesses should expect that California and other states will close borders? Will this even be able to happen in the United States, or not at all? Hey, Californians, you have to stay in California. Yeah. Sorry.
That's a good question. I see where you're going. I think, closing borders between states is going to be difficult. I think right now we have to concentrate on just educating the public, and each region has to institute, severe measures, stay-at-home measures. There are far too many people, socializing, going around to their neighbor's house for dinner, doing, going out playing sports and stuff. There's a lot we can do, which is extremely effective before we get to the question of closing borders. That would be my view.
I think the Canadian model might be the one to look at, if you're looking at it from a business risk point of view. British Columbia has basically shut the border and fining people pretty heavily if they're out without, a real reason. And a real reason is being very specific, allowed outdoors once to exercise,
right,
once a day, go to the grocery store once a day, and, go to the doctor if you've got, some kind of permission. And you can validate it. So I think you're going to see that. I was talking to Jeff Perfect earlier today, who's in the UK. Jeff, I don't know if you want to talk about what's going on in London, but London is very draconian right now in terms of your ability to actually leave your home.
Yeah, I think they're approaching it even more draconian than I expected. They are now using drones to follow people. They set up checkpoints on major roads, very similar to the BC model. We can leave the house only to go for essential services, grocery, or effectively walk the dog, because it is the UK after all.
So I know there's a lot of questions on this, and I did want to give Adrian a good chunk of the hour we've got, but we've got a couple other topics